I often find if someone's thinking about getting a cosmetic procedure, Botox is sort of top of mind, but I also find that a lot of people don't really know what to expect when they go to get Botox. So I thought in this video, I would break that down for you. If you're new here, welcome. I'm Dr. Sam Ellis. I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm really here to help you understand your skin and help you find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. I really wanted to make this video because not only as a dermatologist do I get a ton of questions about Botox, but I find that the world of cosmetics can feel a bit intimidating. And I think part of that intimidation is just not knowing what to expect and having anxiety around the unknown. And so by talking about what to expect during a Botox treatment, what you should do before and after, and what are sort of like the norms will make you feel more confident approaching Botox, whether or not you decide to get it or not. Now, I do understand like what your Botox experience is going to vary a bit based on your environment, what part of the country or the world you live in. Are you getting injected by a physician or at a medical spa or at a Botox party? Just kidding. Please never do that. But I do feel like there are certain things that should be consistent no matter what environment you're having a Botox procedure performed in. And there should be certain things to look out for to make sure you're having a good treatment and it's going to be effective for you. I do have a YouTube video where I talk all about Botox and answer a lot of common questions that come up about it, but just as a brief overview, Botox is something called a neuromodulator. It is a protein that you can inject cosmetically to help reduce muscle movement. And by reducing muscle movements, particularly in the face, you can prevent fine lines and wrinkles from forming that usually would happen as a result of repeated muscle movements. For example, if you were to frown or scowl over and over again over the course of your lifetime, you would notice that little lines begin to form between your eyebrows. Or if you smile over and over and over again, you might notice that little creases begin to form at the corners of your eyes. And by getting Botox, you can reduce the intensity of those movements and reduce the way those lines get etched into the skin over time. Botox essentially works by blocking the signal between your nerves and your muscles. So when you disrupt that communication, you can reduce that muscle movement. Botox also has other cosmetic uses. You can use it to slim the face, tighten up the jawline, even lift the brows, and I'll do a separate video about all the different ways you can use Botox to cosmetically enhance things. I should also point out that Botox is a brand of neuromodulator, and there are other pharmaceutical companies that make competitors to Botox, and they all work very similarly. So things like Disport, Jeuveau, Xeomin, Daxxify, these are all different types of neuromodulators that essentially work the same way, disrupting the signal between the nerve and muscles to relax them. Botox has been around the longest, but Disport, Jeuveau, and Xeomin have all been FDA approved for a while now, and oftentimes I get asked about the differences between them, and the differences are quite subtle and more exist on the molecular level. In terms of how they behave in the skin, it's pretty similar. Disport often kicks in a little bit faster. Some people have a preference for one of these neuromodulators versus the other, but I really think of it like Coke versus Pepsi. Some people have like a very strong preference, and some people think they have a preference, but they couldn't really tell the difference. And then Daxxify is sort of like the new kid on the block. The interesting thing about Daxxify is that it lasts a little bit longer in the tissue. So that's sort of its unique defining characteristic, is that when it's injected, instead of lasting 3 to 4 months like the other neuromodulators, it can sometimes last upward of 6 months. I'm going to use the word Botox kind of collectively to refer to all of the different neuromodulators moving forward. So just know when I'm saying Botox, you could substitute that in for Disport, Xeomin, or Jeuveau, with Daxxify being slightly different. So with Botox injections, you can typically expect the results to last somewhere between 3 and 4 months. That is what the clinical data shows. Now, every once in a while, I have a patient come in who tells me like, oh, my friend's Botox lasts for 6 months, or she only has to do it once a year. That is amazing, but that is not the norm. So just so you can be mentally prepared for Botox, you should expect it to last 3 to 4 months. And if you're one of those lucky people who has that longer duration, that's amazing. One thing that's really important to clarify is once you have Botox injected, it doesn't take immediate effect. I think of it like a dimmer switch getting brighter and brighter, and oftentimes you'll start to notice decreased muscle movement within the first couple of days, but it really takes a full 2 weeks to see the ultimate effects. Once it's fully kicked in at the 2-week mark, it kind of plateaus, and then around week 4 to 6, it slowly starts to wear off. So one misconception a lot of people have around Botox is they think, okay, it's lasting 3 to 4 months, so I'm gonna have zero movement or kind of my optimal result for the entire 3 to 4 months. And that's not really how it works. You hit a peak efficacy, you you plateau for a little bit, and then it slowly wears off over 6 to 8 weeks. So I find that sweet spot for your Botox is actually around like 4 to 6 weeks, where it's not that initial decrease in muscle movement, it's kind of softened up a little bit, and that's when I think you look the most natural with your Botox. So if someone's planning Botox for a wedding or photography or a big event, I think getting Botox at least a month in advance is the best way to go. And I should also say it lasts 3 to 4 months if you are getting the appropriate dose of Botox. If you are doing baby Botox, in which a fewer number of units are getting injected, and we'll talk about the concept of units in a second, you shouldn't expect your Botox to last the full 3 to 4 months. If you're getting half a normal dose, sometimes it lasts half as long. I would say on average, my patients come in about 3 times a year or every 4 months to get their Botox injected. Sometimes people go, okay, well, like if it's wearing off, like do I wait till it's fully worn off, or do I come a little bit sooner before it's fully worn off? And I kind of equate it to getting your hair highlighted. There are some people who, as soon as their roots start to show, they want to come in and get it done. And there are some people who go a little bit longer in between. If you stretch your Botox out to 6 or 7 months in between appointments, that's fine. You just won't have the aesthetic benefit that entire time. I inject my own Botox every 4 to 5 months. Honestly, it depends on like how on top of my life I am, but I really like it to wear off pretty much completely in between, unless I have a big event that I have to be ready for, in which case I might do it a little bit sooner. The reason I like to wait for my Botox to pretty much be completely worn off is Botox is a muscle relaxant. And if that muscle is not moving, it tends to thin out. The same way if you weren't working out your biceps or your triceps, those muscles wouldn't be as bulky. And so if you stack your Botox too closely together, and too closely in my mind would be like sooner than every 3 months, you run the risk of atrophying that muscle and making that muscle thin out. And then you lose some of that rejuvenating effect of Botox, and it just starts to make you look a bit gaunt. Every once in a while, I'll hear people talk about muscle atrophy with Botox and the thinning out of the muscles over time if you're consistent with Botox. And I really find that really only happens if you over Botox someone. And if you're really letting your Botox wear off in between treatments, you don't get that atrophy effect, but you still get all the positive effects of it keeping your skin smooth and preventing wrinkles from getting deeper over time. So that's sort of what to expect in terms of the timeline of Botox. You have it injected, you wait 1 to 2 weeks for it to fully kick in, it plateaus for a little while, and then it slowly wears off. I think it's also important that we talk a little bit about like the timing of Botox in terms of when in your life you're a good candidate for it, and whether like preventative Botox is really a thing, because a lot of people go, okay, well, should I be getting Botox before I really need it? So those lines never really get etched in the first place. And I'll tell you what I think about this. In my mind, preventative Botox actually means you're getting Botox once those fine lines are starting to set in. It doesn't mean getting Botox in your early 20s before you have any lines at all. Because if you get to the point where you're just starting to notice etched in lines when your face is at rest, if you go and get Botox at that point, almost certainly those lines can be eliminated completely if you're consistent with Botox thereafter. The only time I'm really injecting Botox on younger patients who have absolutely no lines is if they're doing it for beautification. So they're not really doing it for anti-aging to prevent wrinkles, but they would like a little brow arch, or they have a wide jaw that they would like to slim down, or if they hold a lot of tension between their brows, they're not at the point where they're making lines, but they get a tension headache, or they just feel like they're constantly frowning. Those would be times to do Botox in a younger person, but it's really not to anti-age them, it's to make them feel or look better in different ways. But I really wanted to address that because every once in a while I'll have like a 22-year-old come into my clinic for a cosmetic consultation, and they have older friends that are getting Botox, or they feel like they really need to be on top of it. But if they're really not seeing any lines, I really shift their focus more towards preventing sun damage and really taking good care of their skin with skincare rather than procedures. My goal with cosmetics is typically to get away with doing as little as possible for as long as possible. On the opposite end of that spectrum, I sometimes have patients come in who have deep etched in lines, and that is where Botox isn't going to be particularly helpful. If those lines have already become grooves in the face, yes, Botox at that point will prevent those lines from getting worse, but oftentimes the skin is, I hate to say like too far gone, but it's so damaged and so creased. I think of those wrinkles almost like scars. No matter how much Botox you're putting in there, those deep creases are never going to go away, and you might be looking at alternative treatments like laser resurfacing, chemical peels, or even sometimes a facelift. Granted, everyone ages differently and everyone has different external environmental insults that cause them to either prematurely age or age particularly favorably, but I would say the average Botox patient starts getting it maybe from their late 20s if they have a very dynamic face and they're starting to see those etched in lines, up to like maybe early 50s if you're really, really lucky. And then continuing it about every 4 months thereafter makes a lot of sense. You can also take a pause in your Botox journey. So I treat a lot of women who are of childbearing age, and oftentimes they're getting Botox and then they want to try to get pregnant. And so they take a little pause for a while, and that's totally okay. While you have Botox injected and it's working for you, you're essentially pushing pause on aging. And then if you take a break, your skin just naturally kind of goes back to how it would be. And it's totally fine to pick that Botox back up after you've had your baby. If you're thinking about getting Botox for the first time, typically the first step is to have a cosmetic consultation. So that's what I do with my patients. If I've never met them before, even if they've gotten Botox before, I still want to do a cosmetic consultation. And sometimes in that visit, we are just talking about Botox, and sometimes the discussion of Botox happens within the context of a larger consultation where we're talking about all different types of anti-aging and beautification interventions. During that consultation is when I'm looking at the patient's features, I'm talking to them about their goals, I'm listening to them about their budget. All of those things are what I'm taking into consideration, and then I'm really having a conversation with the patient. I feel like a good consultation is not just the practitioner talking at the patient, but you guys discussing what bothers you, what you'd like to intervene upon, what your goals are, what your expectations of the treatment are, so that you really get something that's tailored to you. I also think it's really important that during a consultation, you never feel pressured to do anything. I say that at the beginning of my consultation with every patient. This consultation is about education. It's not about getting the procedure. And if you want to do something at the end of this consultation, that's absolutely fine, but it's also okay to take time to think about things. If you're getting the vibe from your injector that you need to do something that day, or you absolutely have to, or you just leave the consultation feeling really bad about yourself, to me, that might be a sign that they're not the right person to treat you. And it's okay to get a second or third opinion even. I think it's really good to communicate with your cosmetic practitioner if you've had a good or a bad experience with Botox in the past, particularly if you've had a bad experience, because that educates the injector as to why you might be switching to them. It might also let them know what to avoid in you. I also think it's an important conversation to have because sometimes I find that a patient has had a bad experience with Botox because their expectations of what Botox can achieve are either not realistic or aren't possible. And that's really important for me to know ahead of time so that we can pivot the consultation to actually addressing the cosmetic concern with the right intervention. The consultation is also the time when I'm discussing the risks and benefits of the procedure, as well as the aftercare or how to prepare for the procedure if they're coming in at a later date to do it. With Botox in particular, because it's a fairly quick procedure to execute, oftentimes on the same day that you do your consultation, you can also have your Botox injections done, but it's something worth discussing with your injector. The other thing that's worth noting about Botox is you don't have to have your whole face Botoxed at once. It's okay to maybe start with just the area between your brows and sort of work up to more areas. It's not uncommon that I have patients that are a little intimidated by Botox even after a consultation, which makes a lot of sense. It is a medical procedure after all, and they want to start small, and that's usually okay. If I really think that injecting only one of their facial areas with Botox is going to unbalance them, that's also something we discuss. Also, the cost of the procedure or the fee of the procedure should be discussed during the consultation. It should never be the case that you have the procedure done and then find out how much it's going to cost. It's also not uncommon for clinics to not discuss fees over the phone for certain things. They might give you like a minimum fee for what Botox costs, but until you really meet with the injector and have your own personalized consultation, sometimes giving a cost breakdown doesn't really make a lot of sense. The other thing when it comes to Botox fees that I think is kind of worth talking about because clinics do it differently is whether or not they charge by unit or they charge by area treated. And let me tell you what I mean by that. Certain muscle groups need to be treated with a certain number of Botox units to get them to relax. So for example, this complex between your brows, if you were treating your frown, usually takes somewhere between 15 and 25 units. So if a clinic is charging you based on units and they charge somewhere between $12 and $30 for a unit, you can get a sense of how much that's going to cost. Different areas of your face will require a different number of units, and also the amount of units needed can vary significantly between people. I can have someone who only needs 12 units in this area, and I can have someone who needs 35 units in that area. And so it's also not good practice to compare how many units your friends needed or your mom needed because everyone's different. The other way Botox can be charged is based on area. That's what we do in my clinic, for example, where this area just costs a set fee. And then if you get a second area done, like the forehead or the crow's feet, those are a distinct cost. And some clinics do it that way so that patients don't get hung up on this specific number of units. And really they're paying for an endpoint rather than each individual unit. If you're used to paying in units and then you transition to a clinic that charges by area, it might feel a little bit weird because you don't know exactly what's being injected. One, you can always ask your practitioner, like, how many units are you using? That's not secret information. But I think the idea is that you're just paying for the outcome. The same way when you go get your hair done, you're not paying for how many inches are cut off or how much dye is used. You're paying for the final cut and color. So let's say you've done your consultation, you've discussed with your injector what areas you want to be treated with Botox. Now let's get into what to expect during the injections themselves. First off, I should say the procedure is very quick. Almost universally, when I do someone's Botox for the first time, they go, "Oh, that's it? That was so fast." It's super fast. That's why it's often referred to as like a lunchtime procedure, because you could go in, get Botox injected, and then go back to kind of your daily life without much disruption. So when you're ready to get your Botox, you're typically going to be sitting in a chair. They're going to clean the skin to start, and then they might mark their injection points with some type of marker or pencil. This just gives an outline of where they want to go. I would say some injectors mark their patients, some don't, some mark some of their patients. I mark pretty much all of my new patients and I take a photo of my markings. That way, if we're really happy with how their injections turn out, we can have consistency the next time that they come. And if they need a little bit of a tweak, we can always reference back to those markings to know what adjustments need to be made. But I also have my regulars who really don't need any marking done at all. I think regardless if you're marking a patient or if you're not marking a patient, the whole guide that we're really using as injectors is how the patient's muscles are moving in that moment. So even if I have a pattern of an injection that I've used on a patient before, if they come in that day and their muscles are moving slightly differently, I'm going to make those micro adjustments to make sure their Botox really meets them where they're at in that moment. With regard to discomfort associated with the procedure, Botox is generally pretty comfortable. Again, this is going to vary based on the techniques used, the needle size, if you have someone there distracting you a little bit, but it's not really standard to have numbing cream applied for Botox. Very rarely I've had a patient come in and be like, "What? I'm not going to get numbing cream," especially if they're new to Botox. They just expect that any cosmetic procedure they're going to get numbed for. But I find that patients really don't need it. It's very, very tolerable, even if you're not good with needles or not good with pain. Regarding what Botox feels like, I always describe it as like a tiny pinch. There are certain areas on the face that are more sensitive, like the upper lip and the crow's feet, but oftentimes between the brows and on the forehead, you hardly feel it. And then right after you get injected, you're going to have what look almost like little mosquito bites at every point you were injected. Botox is that neuromodulator protein that's suspended in a little bit of liquid. That's how you're able to inject it. So until that liquid gets absorbed into your body, which usually takes about 5 to 10 minutes, you're going to have those mosquito bites. And I feel like it's so important that I warn people about that, because if I don't and I don't talk to them about it, they go out to their car and look in their rearview mirror and are like, "What did Dr. Ellis just do to me?" So it's really important to understand that for like 10 to 15 minutes after your Botox injection, you're not going to be looking your best. But after that, like no one would be able to look at you and know that you had anything done. Even if they don't apply numbing cream, some places might have you apply a little bit of ice before or after your injections, but that's not standard. And then another question I often get is, if I'm getting Botox that day in clinic, can I have other cosmetic procedures done like lasers or fillers? And my answer to that would be, it depends. If it's your first or maybe even your second or third time getting Botox, I don't recommend doing it on the same day as having other cosmetic procedures, because you want to ensure that whatever cosmetic outcome you have, good or bad, like if you have a side effect, that you can attribute it to one thing. So if you're just getting Botox, you know that if your eyebrow's doing something a little off or you don't like something, you can attribute it to Botox and there's no other variables involved. But honestly, it's not uncommon for me to do laser and filler and Botox all in the same day for the right patient. And sometimes I have people coming from out of town, and if they're not new to Botox and I kind of know their face, that's okay too. So that's kind of the injection part of it. Let's talk a little bit about aftercare and what to do after you have a Botox injection. And honestly, I think this is what's going to vary the most between injectors, and someone's preferences of how they have you take care of their Botox is not necessarily scientifically founded. It might just be like what they're used to saying. And I would just communicate with your injector and make sure that you know what their expectations for you are. I tell my patients they can generally go about their normal day. I ask that they don't do any vigorous exercise for the rest of the day. I ask that they don't lay down for a few hours. Typically I say 4 hours, because oftentimes patients are like, "What do you mean by a few?" So there's no like standard here, but I say 4 hours, no horizontal activities. I also want to make sure that they're not doing yoga or inversions. I want to make sure they're not getting a facial that day or a massage or acupuncture, anything that's really manipulating the face, because really what we don't want is that Botox moving within the first couple of hours. Honestly, after a couple of hours, that Botox is really in there. It doesn't matter what you do. So the next day you should be able to go back to all of your normal activities. So for my patients, I tell them they can put on makeup if they want to, they can do their normal skincare that evening, they can have a glass of wine that night if they want to, and find for whatever reason, a lot of patients ask if they can go on an airplane after Botox, and that is also completely okay. Like you could get Botox and then fly out 2 hours later, and that's not a big deal. There are some side effects associated with Botox, most commonly being a little bit of achiness or like an awareness of the Botox kicking in. Sometimes people perceive that as a headache. So if someone does get a headache after Botox, they can take their normal headache medication, whether that's ibuprofen or Aleve or Tylenol, to make themselves feel better. And that should generally get better over the next couple days. If you do get a headache from your Botox, I think it's worth bringing up to your injector the next time, because sometimes switching the neuromodulator, for example, if you got Disport, switching to Botox, or Botox switching to Disport, can prevent a headache in the future. And then, like I mentioned earlier, you get to sit back and wait for the full 2 weeks for your Botox to completely kick in. And one thing I should say about Botox kicking in over the 2-week period is that it doesn't always kick in evenly. For example, I find that the glabellar muscles between the brows tend to kick in a little bit earlier, and then the forehead kicks in like at a little bit of a delay. And that's important to know and recognize, because if you're kicked in here and not here, you might think, oh, it's not even, or it's not ready, or I'm asymmetrical, but give it the full 2 weeks to let it fully set up. If I have a new patient who has never gotten Botox before, or if they've never had Botox done by me before, I generally like to see them back at the 2 to 3 week mark. And it's not a super long appointment. It's just sort of a check-in. I like to look at their Botox, see how they're moving, see if they need a tweak. Sometimes they are super happy with it. They're like, Dr. Ellis, this is perfect. You're right. I should have done this 10 years ago. But I see something that I want to adjust because I'm an anal perfectionist. But regardless, I find that if you're new to Botox, sometimes you don't even know what to fully look for. And that's why I like to kind of take a step back. I also think if you're an injector and you're watching this, one of the very, very best things you can do, especially when you first start injecting, is see all of your patients back. That kind of feedback is what's going to make you better and better and better. And the last thing I'll say about follow-up is you should feel comfortable with your injector and communicating with them. I've had so many patients over the years who end up in my office because they've gotten Botox elsewhere, and then they're too nervous or intimidated or anxious to go see their injector again. So when you are setting yourself up to get Botox, if you're going to be injected by someone, you really need to kind of take a little look inside and be like, do I feel comfortable with this person? If I had a question, do I feel like they would be receptive to it? And all of that goes into having a good Botox treatment, having an effective treatment, and having good aftercare. So once you've had your consultation, gotten your injections, had your aftercare, maybe a follow-up, you just get to sit back and relax and enjoy the beauty of Botox. It's one of those things where it has such a high satisfaction rate. I feel like so many patients have come to me over the years being like, oh, I'm so nervous for Botox. I've been putting it off. And I'm never, ever pushy. I think you need to be on your own timeline when it comes to doing cosmetics or deciding not to do cosmetics. But like 10 out of 10 times, a patient will come back and be like, yeah, should have done this sooner. It's amazing. And then in terms of how long it's going to last in each individual, like I mentioned before, you kind of have to wait and see. So I feel like once you've done your first round of injections, it's not a bad idea to set up an appointment for 4 months out so you're on the schedule. But if the 4-month mark comes around and your Botox is still going strong, it's totally okay to push it out a month or two also. Once you've kind of figured out how long Botox lasts in you, so for example, I know 3.5 months, it's pretty much totally gone in me, then you can kind of figure out what your timeline is always going to be, and you can have it scheduled ahead of time so that you can always get into the injector that you want. So that's sort of what to expect from Botox injections. I really hope that this was helpful. I'm curious, have you ever had Botox before? What was your experience? Tell me in the comments. As always, thank you so much for watching. Don't forget to like this video and subscribe to the channel, and I'll see you next time.